All right, let's get right into it. There's a new global health strategy on the table, and it's a big deal. It's basically the proposed game plan for navigating a world that, let's face it, feels like it's constantly putting out fires. But let's just pause for a second. Think about it. Your phone is probably buzzing with alerts right now, right? It can feel like we're just bouncing from one crisis to the next. So you have to wonder, is there actually a plan? Is anyone looking at the big picture for our health on a global scale?
Well, to really get what this new plan is all about, we've got to first understand the problem they're trying to tackle. And the folks who wrote this strategy, they summed up our current reality with this one really powerful phrase.
That's it. In a turbulent world. It's short, but it says so much, doesn't it? This is the starting point, the whole reason this strategy even exists. It's a clear admission that, hey, things are chaotic and we need to face that head on. So what does this turbulence really mean in practice?
Well, for starters, you've got pandemics. We all know what that's like, right? We just went through a massive one. And the new thinking is, this isn't a freak, once-in-a-century event anymore. These kinds of outbreaks are probably going to be a recurring thing, and we have to be ready for them, all the time.
Next up, conflict. When we see wars and instability on the news, it's not just a political story. It has a massive, direct impact on people's health. It tears down hospitals, forces people from their homes, and makes it impossible to get even basic medical care. The fallout from that can last for years.
And then, as if that wasn't enough, you layer on the huge issue of climate change. And let's be clear, this is absolutely a health crisis. We're talking about everything from breathing in smoke from wildfires to diseases spreading to new places because of warmer temperatures. It's a direct and growing threat to all of us.
So yeah, you've got pandemics, conflict, climate change, all swirling around and feeding into each other. It is a lot, which brings us right back to the big question. Okay, faced with all of that, what are we going to do about it? What's the plan?
Well, there is a plan. A really detailed one, actually. It's got a super official name, but you can basically think of it as the world's shared to-do list for health for the next 4 years. Okay, let's get the official name out of the way. It's called the 14th General Program of Work. Sounds a little dry, I know, but that number, 14, is actually important. It tells you this isn't something that was just dreamed up. It's part of a long series of plans, building on everything that's come before. But really, at its core, it's a global health strategy for 2025 to 2028. Simple as that. It's focused, it has a deadline, and it's designed to be a real guide for countries all around the world. And when you dig into it, the whole thing really comes down to just two main concepts. And those two big ideas? Equity and resilience. Now, I know these can sound like corporate buzzwords, but here they are everything. Think of them as the two giant pillars holding this whole plan up. They're the end game.
So let's unpack that. First up, equity. And this is super important. Equity is not the same thing as equality. Equality is giving everyone the same size 10 shoe. Equity is making sure everyone gets a shoe that actually fits their foot. In healthcare, this means actively fixing unfair disadvantages, making sure that a person's health isn't determined by where they live or how much money they have.
And the second pillar is resilience. So if equity is about being fair, resilience is about being strong. It's about how well we can take a hit and get back up. Can our hospitals handle another surge? Can a town recover after a massive flood? It's all about being prepared to face those shocks we know are coming and bouncing back, maybe even stronger than before.
And here's the key, you can't have one without the other. They have to work together. Think about it. A super strong, resilient health system that's only for the wealthy isn't fair. That's not equity. On the other hand, a perfectly fair system that collapses during the first week of a crisis isn't strong. It's not resilient. You absolutely have to have both. Fairness and strength. Together.
Okay, so the goals are clear. We want a world that's more fair and more strong when it comes to health. So, what's the timeline? How are we actually going to get this done?
And this is where it gets real. This isn't some far-off dream for 2050. No, this is a 4-year sprint. The clock starts ticking in 2025 and it stops in 2028. That short time frame is on purpose. It's meant to create urgency, to make sure things actually happen and people can be held accountable.
So let's pull it all together. What we have here is a roadmap. We're living in this turbulent world. We've got the pandemics, the conflict, the climate crisis, and this is the proposed game plan to get us through it. It's a 4-year push, all built on those two big ideas, making our health systems more fair and much, much stronger.
And that really leaves us with a big, lingering question, doesn't it? It's an ambitious plan for sure, but can 4 years really be enough to set us on a new path? Enough to build something that's not just better for us now, but for our kids and their kids? The world will definitely be watching.